Reports and visual evidence appearing to show intensive care units managing severe respiratory and hemorrhagic cases have recently gained significant traction online, bringing renewed public attention to the orthohantavirus genus. While the footage circulating across digital platforms has sparked considerable alarm, public health officials and virologists emphasize the importance of understanding the factual clinical profile of these pathogens. Hantaviruses are a family of viruses spread mainly by rodents, and they can cause a range of serious illnesses in humans. These illnesses are generally categorized into two primary clinical presentations based on the geographic region and the specific viral strain involved: Hantavirus Pulmonary Syndrome, or HPS, which is more common in the Americas, and Hemorrhagic Fever with Renal Syndrome, known as HFRS, which is primarily seen in Europe and Asia. The recent surge in interest follows claims of localized outbreaks, though official surveillance data remains the primary metric for assessing actual risk levels. Unlike many other viral respiratory diseases that have dominated global headlines in recent years, hantaviruses are typically not transmitted from person to person. The primary route of infection is through the inhalation of aerosolized viral particles derived from the urine, saliva, or droppings of infected rodent reservoirs. This means that while a specific cluster of cases in a medical facility can appear harrowing, the risk to the general public often remains tied to specific environmental exposures rather than casual social contact. Each year, thousands of cases are reported globally, but the severity of the disease and the high mortality rates associated with certain strains, reaching up to 38% for some New World hantaviruses, justify the rigorous monitoring protocols currently maintained by organizations like the Centers for Disease Control and Prevention and the World Health Organization. This introductory segment will examine the current framing of these reports, the biological nature of the virus, and the specific ecological conditions that lead to human spillover events. The clinical progression of hantavirus infection, as described in medical literature and seen in hospital settings, is often rapid and requires sophisticated laboratory intervention for confirmed diagnosis. In the early stages, patients typically present with non-specific symptoms, including fever, severe muscle aches, and fatigue, which can complicate initial triage in a busy clinic or emergency department. However, as seen in the reported ICU developments, the disease can quickly transition into a critical phase. In cases of Hantavirus Pulmonary Syndrome, this involves a sudden onset of shortness of breath and coughing as the lungs fill with fluid, a condition known as pulmonary edema. This is caused by a massive immune response that leads to increased capillary permeability, essentially causing the blood vessels to leak fluid into the surrounding lung tissue. Laboratory confirmation is a multi-step process that usually begins with serologic testing to detect IgM and IgG antibodies specific to hantavirus. Because the symptoms can mimic other severe respiratory or febrile illnesses, molecular testing via reverse transcription polymerase chain reaction, or RT-PCR, is often employed to detect the viral genetic material directly in the blood or tissue samples. Surveillance agencies monitor these lab results to track the movement of the virus through rodent populations and to identify any potential mutations or shifts in geographic range. In the intensive care unit, there is currently no specific antiviral treatment or vaccine widely approved for general use against all hantavirus strains. Management is primarily supportive, focusing on maintaining oxygen levels and managing fluid balance. In the most severe cases, clinicians may utilize extracorporeal membrane oxygenation, or ECMO, a highly specialized form of life support that circulates the patient's blood through an artificial lung to provide oxygenation while the body attempts to recover. This level of intervention explains the high-intensity environment depicted in recent footage, highlighting the strain that localized clusters can place on regional healthcare infrastructure. Effective management of hantavirus risk relies heavily on rigorous public health surveillance and proactive environmental prevention strategies rather than reactive medical treatment alone. Health departments and ecological researchers conduct ongoing field studies to monitor the population density and infection rates of known rodent carriers, such as the deer mouse in North America or the bank vole in Europe. These trap and release programs allow scientists to predict mast years, where an abundance of environmental food sources leads to a surge in rodent numbers, subsequently increasing the probability of human exposure. For the general public, prevention is focused on minimizing contact with rodent habitats and safely managing areas where rodents may have nested. Official guidance stresses the importance of avoiding the aerosolization of waste. For example, health agencies strongly advise against sweeping or vacuuming dry rodent droppings, as this can launch viral particles into the air. Instead, a solution of bleach and water is recommended to saturate the area before cleanup. In terms of global logistics and travel, while hantavirus is not typically a driver of broad international travel restrictions, individuals working in agriculture, construction, or those engaging in outdoor recreation in endemic areas are advised to remain vigilant. There are still significant limits to our knowledge, particularly regarding the long-term drivers of viral evolution and the exact mechanisms of the rare instances of human-to-human transmission recorded with the Andes virus in South America. Scientists continue to work on vaccine candidates, but the diversity of hantavirus strains presents a significant hurdle for a universal preventative measure. As public health officials continue to monitor the situation, the emphasis remains on factual reporting, environmental hygiene, and early clinical recognition to mitigate the impact of this persistent zoonotic threat. For more updates on emerging public health reports and global surveillance, consider subscribing to this channel. The core developments in current Hantavirus Reporting Center on the high acuity clinical management of patients within intensive care units, an environment that has become the focal point of recent visual reports circulating online. While the footage appearing to show medical staff battling acute respiratory crises has caused significant public concern, medical authorities emphasize that these scenes reflect the standard, albeit intensive, protocols for treating Hantavirus Pulmonary Syndrome, or HPS. In a clinical setting, the transition from the prodromal phase, characterized by fever and myalgia, to the critical respiratory phase is often sudden and is referred to by clinicians as the clinical crash. During this stage, the primary physiological challenge is a condition known as systemic capillary leak syndrome. This occurs when the virus affects the endothelial cells lining the blood vessels, causing them to become highly permeable. As a result, plasma and other fluids leak out of the vascular system and into the alveolar spaces of the lungs. The bloody cough, frequently cited in recent reports, is often a manifestation of this acute pulmonary edema, where the rapid accumulation of fluid and the rupture of small capillaries lead to blood-tinged secretions. This necessitates immediate and aggressive respiratory support, often involving mechanical ventilation, or, in refractory cases where standard ventilation fails to maintain adequate blood oxygen levels, the use of extracorporeal membrane oxygenation, known as ECMO laboratory and diagnostic agencies, play a critical role in verifying these reported outbreaks, moving beyond the anecdotal evidence found in digital media. Confirmed diagnosis of a hantavirus infection is a rigorous process that typically occurs in specialized reference laboratories. The primary diagnostic tool is serologic testing, specifically the detection of hantavirus-specific immunoglobulin M, or IgM, antibodies, which indicate a recent infection. These tests are often paired with immunoglobulin G, or IgG, assays to track the immune response over time. Because the early symptoms of hantavirus are indistinguishable from common influenza or other viral hemorrhagic fevers, laboratories also utilize reverse transcription polymerase chain reaction, or RT-PCR, to detect viral RNA directly from patient blood or tissue samples. This molecular approach is vital for identifying the specific strain of the virus, which in turn helps public health officials trace the infection back to its specific rodent reservoir and geographic origin. Agencies such as the Centers for Disease Control and Prevention and the World Health Organization maintain standardized surveillance definitions to ensure that only laboratory-confirmed cases are recorded in official tallies, providing a necessary counterweight to unverified reports or inflammatory headlines. From a surveillance and logistical standpoint, health departments focus heavily on the intersection of human activity and rodent ecology. When a cluster of cases is identified in a specific region, Environmental health officers are dispatched to conduct site assessments, looking for evidence of rodent infestations in homes, outbuildings, or industrial sites. While the source material highlights the shocking nature of the ICU environment, the underlying public health work is often a slow, methodical process of data collection and environmental sampling. Surveillance also extends to monitoring the healthcare infrastructure's capacity to handle surges in high pathogenicity cases. Hospitals in endemic areas are required to maintain strict isolation protocols, not necessarily because hantavirus is easily spread between people. It generally is not, but because the severity of the illness requires a high level of protective equipment for staff and a controlled environment to prevent the secondary aerosolization of contaminated materials. Regarding trade and travel, unless an outbreak is definitively linked to a specific transport vector, international shipping is rarely disrupted, however. Officials remain vigilant about the movement of goods from areas with known high-density rodent populations. Currently, there remains no widely approved antiviral therapy that has proven consistently effective in reducing mortality across all hantavirus strains, meaning the core of hospital-based development remains focused on refined supportive care and early intervention to prevent the onset of irreversible respiratory failure. The response to hantavirus outbreaks, while often framed by dramatic imagery of intensive care units, relies most heavily on standardized public health interventions and individual prevention strategies designed to break the chain of transmission at the environmental level. Because there is currently no cure or specific treatment, health agencies emphasize that the most effective tool is the rigorous exclusion of rodent reservoirs from human living and working spaces. This involves a multi-tiered approach to what is known as rodent-proofing. Practical guidance from organisations such as the CDC and the ECDC suggests that any opening larger than 1/4 of an inch, roughly the width of a pencil, must be sealed, using materials that rodents cannot chew through, such as steel wool or heavy-duty wire mesh. Beyond physical barriers, managing the attractants that bring rodents into proximity with humans is critical. This includes the secure storage of food, grains, and animal feed in rodent-proof containers, and the removal of brush or wood piles from the immediate vicinity of residential structures. The primary danger to the public remains the aerosolization of viral particles, a concept that is often misunderstood during times of internet-driven alarm. When rodent urine, saliva, or droppings are disturbed, the virus can become airborne in microscopic droplets. Consequently, the single most important piece of public health advice for cleaning potentially infested areas, such as seasonal cabins, sheds, or barns, is to never use dry cleaning methods like sweeping or vacuuming. These actions can launch the virus into the air where it is easily inhaled. Instead, officials recommend a wet cleaning protocol, saturating the area with a disinfectant, typically a mixture of 1 part bleach to 9 parts water, and allowing it to soak for at least 5 minutes before wiping it up with paper towels or rags. This chemical intervention effectively deactivates the virus's lipid envelope, rendering it non-infectious. For those working in high-risk environments, the use of personal protective equipment, including gloves and N95 respirators, provides a necessary layer of defense against accidental inhalation. From a surveillance perspective, the limits of current medical knowledge remain a significant challenge for global health authorities. While most hantaviruses are zoonotic, meaning they do not spread between humans, the Andes virus in South America has demonstrated a rare capacity for person-to-person transmission, which keeps epidemiologists on high alert for any genetic shifts in other strains. Furthermore, the development of a universal vaccine remains elusive due to the high genetic diversity of the orthohantavirus genus. A vaccine effective against the Sin nombre virus in North America may not provide cross-protection against the Hantan or Pumala viruses prevalent in Europe and Asia. This uncertainty underscores the importance of sentinel surveillance, where researchers monitor rodent populations for changes in viral prevalence, often linked to environmental factors like increased rainfall or mild winters that lead to mass dying events, a surge in food sources that causes rodent populations to explode. In closing, while the footage of clinical crises and the bloody cough associated with advanced hantavirus infection are undeniably distressing, They represent the extreme